Thank you, sir, for the kind introduction. At the outset, I would like to thank the scientific committee of the 3D and Dr. Vijayakumar in particular for giving me this opportunity. And coming to pre-diabetes and its management like that, actually, we as physicians have taken it very lightly, but this is very serious, just as what Mohan and study has shown it. If there are 100 million people suffering with diabetes, there are 130 million people suffering with pre-diabetes. So the flow of my talk will be on these lines: the definition of epidemiology, the impact on cardiovascular complications, the interventions in pre-diabetes and prevention of type 2 diabetes, pre-diabetes awareness and screening, and finally I end my talk with summarizing the whole thing. So, pre-diabetes is a state of impaired glucose homeostasis that may precede overt diabetes. So, the ADS defines IFG, impaired fasting glucose, as fasting plasma glucose between 100 and 125, and IGT is the fasting plasma glucose same values, but the 2-hour postprandial glucose is between 140 to below 199, and A1C is 5.7 to 6.4. And the World Health Organization and the IDF defines IFG as fasting plasma glucose more than 110, below 125, and if at all PP is done, the 2-hour PPG is below 140. So, coming to the IGT, IFG is only impaired fasting glucose. So, the postprandial is normal, but the fasting value is high. And IGT is fasting plasma glucose is above 110, below 126, and 2-hour postprandial is above 140, below 199. That is the definition of the World Health Organization or the IDF. So, if you look at the individuals with impaired fasting glucose, they are at increase, as well as the IGT are at increased risk for the future development of diabetes. So that is, and you can see here between 103 to 109, 110 to 124. These are all not normal, but they are at risk for future development of diabetes. That is where we have to intervene. So, the EDA defines A1C between 5.7 and 6.4 as pre-diabetic values based on risks of developing diabetes and for cardiovascular disease. Compared with fasting plasma glucose, A1C was similarly associated with an increased risk of developing diabetes and more strongly associated with the risk of CVD. If you look at the global estimates, I think there are far more than this slide shows you. Globally, there are 318 million, that is 1 out of 15 adults. North American, Caribbean, 1 out of 7 adults, and in Europe, 1 out of 24 adults are suffering with pre-diabetes. And coming to, this is actually an old slide wherein it was estimated that in 2015 there was about 36.5 million people suffering with pre-diabetes. But if you look at the recent study, a whopping 130 million people are suffering with pre-diabetes. It can be IGT or it can be IFG. And so there are almost, if you look at the, even in Pakistan, almost doubling of the pre-diabetes is seen here, and even in the Middle East. So the incidence of cardiovascular disease and all-cause mortality increase as glucose metabolism deteriorates. You can see it here clearly. As the IFG goes up and IGT, the risk of cardiovascular disease and all-cause mortality actually also increase with the increasing glucose metabolism. And again here, the fasting and the postprandial glucose levels are associated with increased cardiovascular disease risk. Impaired fasting glucose increases the risk of CVD mortality, as has been stated earlier, and IGT is also associated with increased risk of CVD mortality compared with IFG. So, both IGT and IFG are associated with increased risk of CVD and mortality. Coming to the interventions, here lifestyle intervention always plays even in the previous talk given by Dr. Bhavatarani, she also has told us that lifestyle intervention does play a role in preventing the PCOS. And here the Finnish DPS study has shown over 6 years follow-up, there is a 58% reduction in the progression to diabetes. And lifestyle intervention with DPP study also has shown a 4 years follow-up has shown a 58% reduction in progression to reducing the progression to diabetes. And they were followed up for 10 years. There was 34% reduction in the progression to diabetes. The Darkwing study, which then they were followed for 6 years, there was more than 51% reduction in the progression to diabetes. And they followed for 20 years, 43%. So all these trials show us that lifestyle intervention is the only thing that can prevent the progression to diabetes from the pre-diabetic stage. So, as time is short, I will not go into the details of these studies. I will talk about the objective of the study. The objective was to determine the effect of a lifestyle change program in preventing or delaying the onset of type 2 individuals with diabetes. And here, lifestyle intervention was the main thing. 7 sessions with a nutritionist during 1 year were given, and every 3 months thereafter for weight reduction target was to reduce below 2.5 kgs, dietary modification wherein less than 30% energy intake from fat and increased physical activity was advised. And to control was initial general information on the lifestyle changes and annual follow-up was done. And there were 522 participants so here you can see clearly its effect on the weight and progression to diabetes. A 58% reduction on the progression from pre-diabetes to reduction in the progression to diabetes was seen here in this study. The diabetes prevention program. So here again, you can see here the lifestyle intervention did play a very important role. The aim of the study was to determine the effect of lifestyle change program or treatment with metformin in preventing or delaying the onset of type 2 diabetes in individuals with IGT. So you have on one arm the intensive lifestyle intervention, 1079 subjects, and then you had in the other arm standard lifestyle intervention plus metformin, 1073 subjects, and the third arm you had the standard lifestyle intervention plus placebo, wherein 1080, almost equipoised. So, and you can see here almost again a 50%, 58% reduction in the prevention of progression to diabetes was seen, suggesting again that lifestyle modification does play a very important role in the prevention of diabetes and also progression to diabetes from the pre-diabetic stage. Now what we call as reversal is the same thing. So very, very important. If a patient loses 10 kgs or 15 kgs with the latest drugs that we have in hand, certainly you can reverse diabetes. That's what actually we talk to our patients in practice also. And the DPP trial also showed the same thing. And the objective was to quantify and predict the diabetes risk reduction during the DPP OS in participants who returned to normal glucose regulation at least once during the DPP program compared to those who consistently met criteria for pre-diabetic. And we look at the anti-obesity medications which can reduce the progression to diabetes. The Xendos, very popular trial, all of you are aware, done with orlistat. And they looked at, they followed that subjects for about 4 years, and there was a 45% reduction in the progression to diabetes. The Blossom trial, which was done for 1 year, follow-up with lorcaserin, there is a 36% reduction in the progression to diabetes, and the sequel with phentermine and topiramate, there is a 79% reduction in the progression to diabetes, and the scale study, which was followed up for 3 years, wherein liraglutide was given, there was an 80% reduction in the progression to diabetes, suggesting again that weight loss plays a very important role in the prevention of diabetes or reversal. And when we look at the management here, the criteria for diagnosis of pre-diabetes is having a fasting plasma glucose value between 100 to 125, 2-hour plasma glucose from 140 to 199. That's clear. A1C between 5.7 to 6.4. And what are the indications for metformin therapy? The DCJ has recently I think it has advised to start metformin therapy in the pre-diabetic stage. So in age below 60 years, BMI more than 35, history of GDM, fasting plasma glucose more than 110, A1C above was 6%, and also patient preferences also. Some people, they don't want to use drugs. They say, we'll try only with diet and exercise. Initially, we used to say, okay, don't bother. You follow diet and exercise. Then they never used to come. They used to come after 5 years with full-blown diabetes. So we are losing a chance to intervene to prevent or try to reverse the diabetes or the reversal from pre-diabetics to the normal stage. So lifestyle modification, intensive lifestyle modification consists of calorie restriction and about around 700 calories per day restriction is good, and increased physical activity 150 minutes per week, and now I think that has been increased to 300 minutes per week, and self-monitoring is very important, and finally motivation support that cannot be underestimated. Above all, decrease the incidence of diabetes by 6.2 cases per person years during a 3-year period. So all of the lifestyle modification, you had 6.2 cases per 100 person years during 3-year period, reduction in the incidence. Coming to metformin, metformin decreased the risk of diabetes among individuals with pre-diabetes by 3.2 cases per 100 person years during 3 years. And metformin is most effective for women with prior gestational diabetes and for individuals younger than 60 years with BMI of 35 or greater, fasting plasma glucose level of 110 or higher, or A1C level of 6%. So coming to the awareness, even in the United States, the awareness of pre-diabetes is low. 9 out of 10 individuals with pre-diabetes do not know they have it. The screening recommendations for detection of pre-diabetes, the ADA suggests that the criteria for finishing one more slide. Criteria for testing for diabetes or pre-diabetes in asymptomatic adults with overweight or obesity and have more than one additional risk factors. All patients aged above 45 years, and if results are normal, testing should be repeated at a minimum of 3 years interval. So in practice, I suggest all my patients to bring their siblings and their children for testing at the age of 30 years. And World Health Organization does not suggest any screening recommendation. So finally, I'll summarize that pre-diabetes is a state of impaired glucose homeostasis that increases the risk of developing overt diabetes, and it is also associated with increased risk of CVD and all-cause mortality. And as obesity and pre-diabetes are a major risk factors for developing diabetes, successful weight management and glycemic control are keys to reducing its burden. Thank you, sir.